We have plenty of chairs over here. If everyone could grab a seat, we'll go ahead and get started. Thanks.
Good morning. Can everyone hear me okay? Good. A little louder? Is this better? Okay. So I'm Dr. Samantha Gomez-Yamsantikul, and I'm the Associate Medical Director here at South Texas Blood and Tissue. I want to thank everyone for being here to discuss the national blood shortage and how it's impacting South Texas and San Antonio. Over the past 2 years, we have shared how the pandemic has impacted the blood supply, with businesses being closed, schools being closed, and over 1,000 blood drive cancellations. I want to say thank you, though, to the tireless efforts of Mayor Nierenberg, City Council, Judge Wolf, and other local leaders like Eric Epley from STRAC, the continued support of local media, as well as our community. As a result, we've actually seen a small increase in the number of blood donations, but it's not able to keep up with the increased demand that we've seen across the region. And demand is up 15%, likely due to the growth of San Antonio. So our goal has always been to have a 7-day blood supply, 3 days at minimum. And right now, our total blood inventory is around 2 days, with O positive around half of a day. This is the worst I have ever seen it in the 8 years that I've been here. This is also coupled and troubling with some trends we're seeing in our donor demographics. And that includes a 60% drop in donations from donors aged 16 to 19, and also a 30% drop in new donors. And so new donors and young donors are really key to having a sustainable blood supply. While we have traditionally relied on baby boomer donors, and they have definitely stepped up during this pandemic, these donors are transitioning as they age from blood donors to blood recipients. And so we need to fill that gap with young donors and new donors as our city grows and our hospitals expand. There have been some silver linings in this pandemic, and that includes the collaborative nature of our relationships with our chair people and our people out in the community to set up blood drives. We have had some really great ideas with some of our local businesses, as well as Methodist Healthcare and Christus Healthcare, in finding new ways to encourage blood donation and also ensuring the safety of donors and staff. So in addition to Mayor Nierenberg and Judge Wolf, we're very pleased to have representatives from area hospitals, including Dr. Leslie Grievin from University Health System, Dr. Joyce Schwartz from Methodist Hospital, and Dr. Teresa Duran from Baptist Health System. I work really closely with these physicians as well as staff at the hospital as we review all of the hospital orders to our blood center and match it against our blood inventory. And so every day decisions are being made on what blood goes to which hospital based on usage and surgery and whether there's traumas at that facility. So to explain the impact on hospitals and patients, I'd like to invite Dr. Schwartz, Medical Director of the Blood Bank at Methodist Hospital, followed by Dr. Leslie Grievin, Medical Director of Transfusion Services from University Hospital.
Thank you, Dr. Gomez. I appreciate it. Good morning. Again, I'm Dr. Joyce Schwartz. I'm the Medical Director for the Blood Bank at the Methodist Hospital here in San Antonio. The blood shortage is an extremely critical matter for all of us, and it is not exaggerating to say that it's truly a life or death situation. I want to be certain that you all know that there is no substitute for blood. And during the past few months, all of our hospitals have experienced a severe shortage of blood. Our patients are dependent on blood donors showing up every single day. While I'm extremely grateful for those donors who have shown up and rolled up their sleeves to donate in the past, the need does not stop. I'm asking the public to step up and help us with this severe shortage. Blood must be transfused within 42 days of donation, and some blood products like platelets must be transfused within 7 days. So these products must be constantly replenished on our shelves. So many of our hospitalized patients require blood. Our trauma patients, those cancer patients that are on chemotherapy, new mothers and their newborns, our transplant patients, whether they've received a new heart, a new lung, a new kidney, a bone marrow transplant. All of these individuals require blood, must have blood to survive. It may be that one of your friends, your family, or your neighbors will be the recipient of your donation. So if you are lucky and are healthy and want to help save a life, please schedule an appointment today and give blood. It may be the most important act that you do during this stressful time. Thank you for your time.
Hello, good morning. I'm Leslie Grievin. I am the Medical Director at University Hospital Transfusion Services. And on behalf of our team, we want to just represent some of our patient populations. Apologize. Some of our patient populations that are in dire need currently. We are a level 1 trauma center, and we are one of the area's only resources. The other resource is the military base here in town. But we do serve all of our community for those needs. We also have a very heavy transplant population, and a lot of those donors require a lot of blood products. Additionally, we are a referral center for ACRETAs, which are the high-risk bleeding obstetric patients and new mothers. So along with that, we serve, like the other hospitals, additional sick individuals, and so our blood needs are very high. We do have our own blood donor services at University Hospital to try to support the community and allow other hospitals the opportunity to have this life-saving source. But we highly rely on South Texas Blood and Tissue as our partner. And so we urge donors to go wherever they can to donate within our area. And as noted before, we have to have a constant supply of blood. Therefore, it's important if you try to make an appointment now and you're not able to because we've had an increased demand of donors willing to reach out, please make sure to schedule your appointment in advance in the next few weeks, and then make sure to redonate every time you're eligible at future times so that we always have this life-saving support available for our patients. Again, this is kind of unprecedented in the level of shortage that we're experiencing. I have not seen anything like this in my previous 10 plus years within medicine, and my predecessors before me who have practiced for over 40 years have not experienced the level of this shortage that is being present now. As a medical director, I have to say one of the most challenging things is to call the surgeons or the treating physicians and have to ask the prognosis of the patient. How are they doing? Are they likely to live? And how much resources can I continue to allocate to their patient? And we have to have very strong ethical discussions surrounding patients. And that's no position that anybody wants to be in as a physician, and we don't want to place any family as in that position for their loved ones that may be on the other side of that decision. So I urge everyone to please donate often and early and as much as possible. So thank you very much.
Thank you, Dr. Schwartz and Dr. Griebon, for those really impactful statements. I will now introduce Mayor Ron Nierenberg to speak on the impact of the blood crisis on San Antonio. Thank you.
Good morning, everyone. As we've heard, the COVID-19 pandemic is a global crisis. It's impacted virtually every aspect of our lives here in San Antonio. But another national crisis that has impacted and hit us here locally is the blood crisis, as the pandemic keeps donors at home and shuts down blood drives. More than 1,000 drives were canceled last year, and that trend is continuing as the Omicron surge sweeps through our community and our region. We are here today to declare a blood emergency in San Antonio, Bexar County, and the metro area. Even as the COVID-19 pandemic inhibits blood drives and donors, San Antonio, our population growth remains the fastest in the nation. With that growth comes more demand for blood, and that demand will not stop when the pandemic ends. 5 major new hospitals were announced this past year, and that is encouraging. Most notably, blood transfusions are the #1 procedure in hospitals. We can't wait until these new facilities are open to address our chronic blood shortage. Our community needs individuals to step up to become regular donors, including new residents and lifelong residents who have never donated. And we do realize that businesses and organizations are cautious about protecting customers and employees. So please come back to the table, sit down with the South Texas Blood and Tissue Center and University Hospital. You'll find that they have developed COVID safety protocols and new innovative ways to support blood donations. I want to thank Valero, Frost, HEB, Santikos, WashTub, NISD, to name a few, that all have worked with the South Texas Blood and Tissue Center to develop new models to encourage employees and customers and the general public to give blood. We are all in this together. That's what we said at the beginning. It remains true and will remain true going forward. And donating blood is a great way to help your neighbors and your community. You can literally help save lives by donating blood. The city wants to help lead the way, so the City Council District Challenge blood drives kick off this Monday and run all next week. It's a competition that we hold twice a year, and with a blood drive in each of the 10 council districts, there's plenty of places to go. So get more information and schedule an appointment at southtexasblood.org. Your neighbors need your help, so thank you very much.
Thank you, Mayor. Next is Judge Wolf to speak on the impact.
Thank you, Dr. Gomez. Let me first of all thank the Blood Bank for 47 years of service to this community. Many years ago, my youngest son worked here, so I was over here quite frequently for a number of years. And when I was a bit younger, I managed to give blood a few times here also. So great work. And then BioBridge Global, who works with the blood bank and has done great strides in regenerative medicine and cellular therapy, and the process that they started on the east side of San Antonio now. So first of all, a great organization here. So you can be assured that if you're going to come here to give blood, that you're going to be taken care of in the best manner possible, and that you will have a number of questions to answer to make sure that we're safe with you and the way we handle it. So it's very safe to do it here. Leslie talked about University Hospital. That's the Bexar County Hospital District that the Commissioner's Court's responsible for. And Leslie, I was just talking to George Hernandez just a few minutes ago, who's the president now of University Hospital, and we're not only talking about the increased accidents that have occurred. I think after the pandemic, so many people got out on the road and they seem to be driving a heck of a lot faster than they were before. And we are level 4, the highest level in trauma care, and the only other one is Brooke Army Medical. So we're seeing, additional cases there. Also, we're seeing some issues with respect to maternal fetal medicine, where you have high-risk pregnancies, where there's surgery necessary, and where blood is necessary to perform those. So we're at the highest level in terms of that area also. So it's really important to our hospital as well as every hospital here in the community. And hospitals are growing and our population is growing, and we're planning to build 2 new hospitals at University Hospital now. So we're going to need young people to step up too. It's hard to reach you today. I know over the years Bexar County's had a number of functions, but with what we've seen now with the spread of Omicron, that we in the previous ones, we have never been able to do what we were able to do in the past. But so it takes individuals to step up and be willing to donate blood and to help, and it's going to be a crying need. Mayor Nuremberg and I were talking just a little earlier, and And we think that we're still going to have anywhere from a week to 3 weeks of spiking cases. So that adds to the complications of people going in the hospital with multiple problems, medical problems. So do everything you can to step up and give blood and to help save a lot of lives here in San Antonio. Thank you.
I want to say thank you to all of our speakers for discussing their impact. I think Dr. Grievin said it best: donate blood and donate often. So again, we appreciate you being here this morning, and we are available for immediate interviews following this press conference. Thank you so much.